Monday Health Minutes, sponsored by Valley Health.
Your eyesight is precious, but it can be overlooked. I'm Melanie Schaefer. You're here for Valley Health Minutes, and today we're talking with Dr. Elizabeth DiStefano about how important eye care is and what we should all be doing. Talk to us about how often we should be getting our eyes examined. It's so easy to fall out of the routine of doing that.
Sure. We do recommend that you get yearly eye exams. Even if you don't feel like your vision's changing, it's important to get the eye health checked. Things can change very slowly that you wouldn't notice, that we can pick up on when you come in to have them checked. But definitely once a year is what we recommend.
Okay, and it can also clue you into some other problems in your health, that annual exam, not just your eyes, but kind of give you a peek into your overall health.
Sure, we can see signs of things like high blood pressure, diabetes. Those can cause the blood vessels in the back of your eye to get leaky and distort your vision. High cholesterol can block those same blood vessels and cause permanent and sudden vision loss. We can see other things like macular degeneration, which can be sped up by smoking, cataracts, another thing that smoking can affect. A lot of times we can see signs of diabetes before even your primary care doctor can pick them up.
So it can be super helpful for your overall health.
Absolutely.
For sure. When should you start bringing your children in? What's the youngest age that you should start having your children's vision checked?
We see kids as young as 6 months. Definitely, if you haven't had your kid checked before they start school, we definitely recommend that you do that. We want to make sure that they're able to have a good start on things when they start school, for sure.
It can have an effect. Poor vision can have an effect on your child. How so?
It can affect their hand-eye coordination, especially when they're developing. If they're not able to see properly with both eyes, especially both eyes evenly, it can affect their hand-eye coordination, their depth perception. And then once they start school, it can affect their reading and language skills and just their overall performance in school. They've also linked poor vision to behavioral issues in kids. If they can't see to do their work, if they can't do the reading comprehension as well, they tend to not pay attention. They tend to kind of get in trouble a little bit more just because they're bored, because they can't see to do their work. Another thing that we've noticed is it can affect job potential in the future. Undiagnosed lazy eyes, if one eye is not seeing as well, certain careers, military careers especially, pilots, train operators, things like that require certain vision in both eyes, and if those things aren't addressed when they're young, it can affect their future.
It's very interesting. Yeah. So it's not just that annual visit, but you're talking long-term effects for sure. Mm-hmm. What kind of services does Valley Health provide as far as vision care goes?
In addition to comprehensive eye exams, we do contact lens exams, diabetic eye exams, children's eye exams. We also can monitor several eye diseases like glaucoma, macular degeneration, cataracts. And then another thing that we do that a lot of people don't realize is we can treat different eye conditions like pink eye, and we can also remove metal from people's eyes or other things like that. A lot of people will go to the emergency room or their primary care doctor when actually we have the tools to do that a little bit better. So that's something that they can come to us for instead of bothering the emergency room, because it's not really an emergency and they don't have the best equipment for it.
That's interesting, because pink eye always goes around. Yes. And it never fails. You can have an eye injury just walking through your house. Something can break and fly into your eye. So knowing that you can get that help through Valley Health. How do you make an appointment?
So right now you can call our Valley Health East Huntington or Valley Health Wayne offices to get an appointment. We are opening a new office at the Valley Health Milton Harbor Way location, but that won't be until after the first of the year. I think January 3rd is the targeted opening date for there. So after that, you can also call them to get an appointment.
And any final thoughts on how people should be caring for their eyes?
I definitely think it is something that gets overlooked. So just keep in mind that it is important to get routine vision exams, comprehensive eye exams, and keep an eye on your eye health.
Yeah, your overall health is part of it.
Yes, absolutely.
Dr. DiStefano, thank you so much.
Thank you so much.
Thanks for being here for Valley Health Minutes. We'll see you next Monday.